Hi, I'm Dr. Rahul Gupta, Senior Interventional Cardiologist from Apollo Hospital, Navi Mumbai, India. And it's my pleasure to be here at Haitech Sai Hospital for offering the second opinion in the field of cardiology. So today and tomorrow, we are going to see a lot of patients who are suffering from heart-related ailments, and we are going to offer best possible opinion in the field of cardiology. So back home at Apollo Hospital, we do a lot of complex cardiac work, like for example, minimally invasive surgeries where you have to give only very small incision to do a open heart surgery. Similarly, replacing valve without surgery, which is called as TAVI, or repairing mitral valve through mitral clip. These are non-invasive procedures. And also those cases which are very complex and which have been rejected, and those patients who are suffering from heart disease and are not getting any kind of relief. So those kind of advanced technologies are now available, and we are here to support, and we are here to support all of you, plus give whatever best we can do for these kind of scenarios where it's a difficult scenario or a complex scenario. So I hope all of you take the advantage of our presence and this collaboration with Haitech Sai Hospital of Apollo Hospital and this hospital, so that maximum people can get benefited. The cardiology or the cardiac diseases are number one killer worldwide, and I think every country is suffering from a situation where the cardiac disease has become number one killer. Even if you look at in India, the heart disease is number one killer, or even in the Western world, the cardiac disease is number one killer. So it is very important to identify the symptoms much earlier, like somebody who's feeling breathlessness, or somebody who's getting palpitations, dizziness, giddiness, or somebody is getting swelling over the feet. These could be symptoms of heart disease. Anybody who is feeling unusually tired, like on exertion, which he or she was not previously feeling. I think these are some of the symptoms which we need to evaluate whether it could be related to heart or not. So, if anybody of us is having these kind of symptoms, it is very important that we seek an opinion from a doctor, especially cardiologist, but because this could be a cardiac related disease. Now, if we go into the history of cardiac treatment, the cardiac treatment has evolved from very basic treatment of diagnosis the heart ailments to now very minimally invasive treatment which has started happening. For example, I just told you earlier also that valve which was only possible to be replaced by open heart surgery anywhere in the world now can be replaced without any kind of general anesthesia in an awake patient through the groin arteries, through the arteries of the leg in a very miniaturized form, and the patient can get discharged in 24 to 48 hours. Similarly, those patients who have got severe blockages in the heart, if they have been diagnosed, they are getting chest discomfort, and angiography has been done, and they are feeling, they have been diagnosed with multiple blockages. Previously, only bypass or open heart surgery was the only option, but now with advanced technologies, we have some internal cameras which can actually go inside the heart and visualize the severity of the blockage or the complexity of the blockages, and these patients can also be treated very well without any major surgery, without open heart surgery, through these angioplasty procedures, and patient can go home in 24 to 48 hours. Similarly, those patients who are having electrical problem, like their heart rate goes either very slow or the heart rate gets very fast, these are called as electrical problems of the heart or arrhythmias. These can be managed through radiofrequency ablation or electrophysiological studies and radiofrequency ablation, where the fast heart rate can be treated very well without again major surgery. Similarly, somebody's heart rate is going down and they are becoming dizzy, getting loss of consciousness, a pacemaker can be put. Now we even have a very miniature pacemaker which is the size of a capsule, and it can be done in 15 minutes. So there are a lot of advancement which has happened, which sometimes we are not aware, and sometimes patient doesn't get the right kind of treatment if they are not aware about these advanced technologies. So this is just about the advanced technologies, but then there are very advanced checkups which are also available, which can diagnose the heart problem even before it has started giving us the symptoms. So advanced cardiac checkups are available, genetic testings are available, which can tell us whether we are more prone for developing heart disease. And these preventive health checkups are extremely important for all of us to pick up the heart disease much early, so that we don't suffer from actually major heart problem, and we can prevent them from developing. So I hope this small aware talk is helping you out to understand the cardiac issue, and hope you take the advantage of our presence today and tomorrow, and you can take the help. You can come to the Haitech Sai Hospital, where we are available today and tomorrow for the opinions.
Then what's your advice in matters of lifestyle that causes that's such kind of illness?
Yeah, so I think it's a good question which he has asked, that what is the lifestyle which causes the heart issue and how we can prevent it. So, there is something called as 6E formula, which is extremely important to keep yourself heart attack proof, to prevent yourself from developing the heart attack. So, what is the 6E? The first E is exercising. So, you should exercise daily, and you should include three kinds of exercise: cardiovascular exercise, which includes running, swimming, cycling, anything which increases the heartbeat. Then there is something called as stretching, where you move all your joints. Movement of all the joint is stretching. And toning, where you take body weight, use your body weight or gym weight to tone yourself, which you should do twice or thrice a week. Then the second E is your eating habit. So it is very important that we eat right. That means what is healthy and what is junk. We all know all the oily stuff, deep fried stuff, too much of salt, too much of sugar is all harmful. But if we eat lot of whole grain products, veggies, it may be more beneficial for our heart health. We should also eat timely, and we should eat very peacefully with a happy state of mind, because it helps to secrete digestive juices in a better way and helps in digestion. The third E is your emotional health. Emotionally, we should be all happy, optimistic, positive, because whenever we are in negative emotion, it impacts the heart health. So we should do different kind of meditation, relaxation exercise, deep breathing exercise, to keep our emotional status in a positive state. The fourth E is you should exit your addictions, like smoking. Excess of alcohol is not good. Little bit of moderate amount of alcohol is okay, but excess alcohol is not good. Smoking or any kind of other addictions are also not good. So we should exit our addiction. The fifth E is enough good quality sleep. It is often neglected. That's, sometimes you're not sleeping, you're sleeping for very little amount of time, which is again harmful. And sometimes you're sleeping well, but you are snoring so much that when you get up in the morning, you are not fresh. So you might be sleeping for 7-8 hours, but the quality of sleep may not be good. So enough and good quality of sleep is extremely important. And sixth E, which is last but not the least, is that you should evaluate your risk factors on regular basis. Now, what are these risk factors? Your blood pressure, your sugar numbers, your cholesterol numbers, your body weight, because these are like silent killers, and unless you evaluate them on regular basis, it is very difficult to identify them, because they don't produce symptoms of their own. So therefore, they are called as silent killers. And once you evaluate yourself by regular checkups, you will be able to find out these problems, and you can take proactive action, not wait for the disease to happen, but actually control the risk factor so that the heart disease doesn't happen. And believe me, it has been found that if you follow this 6E formula, which I have just narrated, you can literally make yourself heart attack proof. So I hope this 6E formula is going to bring a lot of changes, but start following it, because if you just listen and don't follow, it's not going to help you. So please start following. Thank you very much.
Hi everybody, this is Dr. Vikram Pavde. I am Senior Orthopedic Consultant at Apollo Hospital, Navi Mumbai. Prior to this, I was Senior Orthopedic Consultant at Queen Elizabeth Hospital in Glasgow, Level 1 Trauma Center, and I am happy to share my expertise which I have developed over there. My special interest is in giving second opinion and performing complex revision surgeries for hip joints and knee joint, because hip joint and knee joint will last 25 years only, and when they don't go well according to the plan, we have to do the revision. Similarly, sometimes anti-cruciate ligament, sports injuries, arthroscopic ligament reconstruction and meniscal reconstruction, we have to redo the surgeries because the first surgery is not performing the way it has been expected. In that case, I am happy to see any patient who has got any issues at Dar es Salaam, and I am in the Haitech Sai Hospital today and tomorrow. I don't want to propagate surgery is the only solution for all the complex cases you have. Sometimes prevention is better than cure. Many times GP refer patients to me for joint replacement, but we must understand what are the real indications for joint replacement. For me, that will be inability to do activities of daily life. That means you can barely walk 10 to 15 minutes and you get severe pain in the knee. Secondly, your night sleep is disturbed. Whenever you turn around in the bed, there is severe pain in the knee. If these are the conditions and you fulfill this criteria, you should think about a knee joint or a hip joint replacement. Similarly, the knee clicking, giving way should not be ignored. An MRI should be undertaken and appropriate treatment arthroscopically should be followed. So I repeat again, I am in Haitech Sai Hospital today and tomorrow, and more than happy to see if I could be of any assistance to the people in Tanzania. Osteoarthritis is age-appropriate degenerative changes. Like human body was supposed to last up to 30-35 years. But now we are going to live up to 95 years in India. And how do we calculate this age? You and me get secondary deciduous tooth only once in the lifetime. But an elephant will get 7 times his tooth eruption. So that way we calculate his age to be around 70 to 80 years of age. Just like a car tire being worn out. The cartilage will be worn out. That is just like the enamel of the tooth. When the enamel is broken or because of infection it is lost, the gum is exposed. And when the gum is exposed, it is richly supplied by nerves. It becomes very painful. Another thing which can accelerate this is trauma. You got an injury, your knee cartilage is destroyed, some fracture, excessive weight, some metabolic diseases like gout, where uric acid could be deposited and the cartilage could be destroyed. Rheumatoid arthritis, we all know, can cause crippling, disabling arthritis of most of the joints. By correcting weight, taking calcium vitamin D supplements and a healthy lifestyle, I think we can prolong the life of our joints which are native to us. Thank you so much for your support.
Ili kuwa mwanafamilia bora wa Global TV, usisahau kusubscribe, like, kushare na kucomment. Baada ya kusubscribe, bonyeza alama ya kengele ili kupata taarifa kwa kila video inayopanda Global TV Online.